I'm Janae Sharp. Welcome to Sharp Conversations. Today we're talking with Dr. Elsie Koh, and I'd love to hear more about your story and your work with physicians.
Hi, Elsie. I'm Subha. I am a hospitalist and founder and CEO of Caroline. I'm really excited for our conversation today. So tell us about yourself, Elsie. Tell us your background. You've had a really interesting path, and you're doing so many things that are not the typical things that clinicians do, and we're really excited to hear about it and how you got there.
Yeah, if you asked me 20 or 30 years ago, or maybe even 10 years ago, I wouldn't expect to be where I am today. And it has to do with a lot of personal growth that has given me the confidence to move forward. I think everyone has that potential, which is why I created Lead Physician. I'm a physician, interventional radiologist by background. I still practice clinical medicine on a part-time basis because I'm also Chief Medical Officer of American Endovascular and Amputation Prevention. We save lives and we prevent unnecessary amputations for patients through peripheral arterial disease, minimally invasive work. And I created a leadership program because I really feel that physicians really have so much more potential with them to be leaders in the field of medicine, to help control some of the chaos that's happening, the burnout, the control in terms of where healthcare is going, the growing costs, and the aging population. All of that together, we kind of understand, deep down what needs to be done from ground up.
I was just going to say, I think that this is a common theme that we've been hearing in some of our latest conversations is around leadership training and empowering clinicians to be able to actually change what they're experiencing and to have agency in how they practice. And it sounds like that's been a similar path for you, but I love that you've created this whole program on teaching clinicians to be leaders, because that's something that keeps coming up as we don't learn enough about that in our education.
Right. What's different is that you really need to marry the leadership, semantics, and logics with personal development. You can't just have, okay, let me teach you communication styles and let me teach you about, how do you create teams? How do you run a successful meeting? How do you do project management? What's process improvement? You need personal growth. You need to be able to believe that you can be in that position. You need to think further than what you've ever done before. You have to understand what discomfort is good. These kind of things need to be married together in order to move forward. You can't just have one without the other.
Okay. How did that happen for you?
That's really important.
Well, was it luck? Was it luck for you, or were you just naturally this way?
No, I'm not naturally this way. Trauma, can push someone forward. Fear can push people forward. But it doesn't have to be that way. I had instances in my life where I remember exactly where I was.
How do we get health system administrators to think like this? Because there is, we're talking about burnout, right? And how do we help any healthcare worker, including doctors and nurses and everybody, bring joy back into their practice and improve wellness and achieve the quadruple aim. I think it's pretty safe to say that most clinicians don't experience what you're describing.
Mm-hmm. Well, personally, so I am on a leadership. I work on the C-suite level, and I work with the leaders in my company, and I'm very close with my CEO, and I make it a point to try and influence how he thinks about things. Not that he doesn't think about the employees, he does, and that's why I want to work with him. But I'm seeing what's going on in each and every one of my centers. I travel to all my centers to see what's going on, to get to know my employees. But I make it a point, it's physicians' job to make their administrators understand.
Okay, especially since we hear now a lot about, if people want to move with restructuring in all jobs across the board, people are switching companies and they're not always happy. Do you feel like there are a few questions that are key questions to ask, or how? I have friends who have just switched jobs because it didn't work, and then also friends who are leaders in companies that were okay, I kept my team, and that's a big deal for them. So how do the people who want to move up or want want better compensation, like how do they start that conversation before all the nurses are walking out, for example?
So the first thing that they have to do is be crystal clear with what they want before they go out seeking jobs and opportunity. You can't just like randomly seek a job that's a CMO or a director or whatever. You're on marketing, or maybe you want to be a consultant. You have to know what are my strengths? What am I really good at? What can I get paid for? It's like that Venn diagram, and that center sweet spot of what you can deliver up and beyond, or you can grow into, is what you're going to go after. And once you're so crystal clear of what that looks like, and how much you're going to get paid, and where you're going to be living, and what are your jobs going to entail, then you start seeking out opportunities and start networking with people. You find organizations, you cut things out that just don't make any sense to you, and then you go for the ones that are really in alignment with your core values and your vision. That's where you're going to be so much more successful in finding the position that you want. People don't start first with themselves.
No.
They just jump to what's out there.
It's harder. I think it's harder to say exactly what you want and what you don't want. I have a question for the next question. So if it's a follow-up, you should go.
It's kind of a follow-up.
Okay.
Which is that, it's follow-up/comment, which is that I mentioned it before, but we talk about agency, and we keep hearing from people that having choice over what you do is such an important factor with burnout. And part of what I'm hearing you say is that through leadership training and through doing some self-reflection on what you want, it kind of helps you start to create your own agency. And, maybe you can't change the situation of where you're in now, because not every leadership or not everyone in leadership has the foresight and the insight as what you're describing. But then it makes you think, well, maybe I need to look somewhere else. And that, I don't think doctors especially do that very much, because we kind of get so wed to thinking, well, I'm here, I have my patients, I have my
there's a lot of fear.
Done.
Physicians have a lot of fear in making changes, and we don't like change. And they say 80% of burnout has to do with institutional issues. 20% has to do with your own personal issues. So if you can at least control what you can in your own circle, and whether or not you decide to help make change happen in an organization, or you have to move out, the fact that you have a choice and that you're here because of your own choice makes you think about your circumstances differently, and the burnout changes. That whole concept of feeling stuck and I have nowhere to go, it changes, and your mind changes, and that affects the way you feel.
Right.
Yeah, it's really interesting.
How did you decide to work with physicians? Like, do you exclusively work with physicians, or do you work with other groups too?
So I used to not just work exclusively physicians, and people have asked me, can you work with non-physicians too? And I have, and it's been rewarding in that sense. And I am constantly beating myself up about, like, should I open this up to just leaders, or should it be leaders of all people, sizes and shapes within healthcare, so that physicians feel like they're in a more realistic environment, working with nurse coordinators or CEOs or whatever. So it's evolving. This has started during the beginning of COVID for me. That's when I created this platform. And like I said, I do have a full-time job still. So
So you're not busy.
So,
you're not busy, I hear. You got time.
I am the busiest I have been in my entire life, but I'm not burned out. Isn't that weird?
I love that.
Because you know what? I'm passionate about what I'm doing.
Yeah.
I love what I'm doing. Yes, I'm tired of some of the traveling that I'm doing, but I negotiated that with my CEO, so about how that's working out. But there's always solutions, and there's always things you need to talk about. That's my thing with people. Like, you don't have to feel stuck. There are choices that you can make, and there's things that you can say. There's how you communicate it to people, and how you think about yourself that matters. And it makes all the difference in the world.
What do you say?
Janae, you were going to ask me a question.
I was going to ask specifically more about that, like how you think about yourself, because we've done some work with physicians that are depressed or have like a history of mental illness, and they cover up a lot. And also working with women in general, like sometimes there's such a disconnect between the skills they actually have and the skills that they think they have. Like, and at times I've been like, why don't you just like channel
And
your overconfident man inside, you know? Like,
so you know what? That has everything to do with self-image.
yeah,
There's a book by I have so many freaking books here.
I love books.
It's called Psycho-Cybernetics by Maxwell Maltz. He's a plastic surgeon who wrote a book on self-image called Psycho-Cybernetics. And he says that we all have two self-images. The one that you're talking about where everyone sees you as being this confident being and knows it all, and it's perfect life and blah, blah. The other self-image is what you really feel inside, which may be a major disconnect between the outside and inside. So the whole purpose is to, and what I talk about is developing your true self-image to the point where you're really being authentic to yourself and being the person that you know that you can be.
I want to go back and ask, I'm not a physician, right? What do you think people outside need to know about your work? This wasn't on our list of questions, by the way. I just made it up because it's a real question I have. Like physician,
No, I mean,
health systems do better with physicians in leadership, and there are these programs, you know. But like, what do people from the outside need to know?
yeah, you don't necessarily have to do my program, but I would encourage any physician who knows that they have so much more than what they're doing right now. They're not really comfortable where they are. They need some direction. They think that there might be some blind spots. They're not really sure what it is. They don't really have a goal that in mind. That's the kind of person, and you know what? They think they could be in leadership, and that's the type of person who's really ready for change, not somebody who's like, don't tell me what to do. That attitude, you have to be in the right place to want to be coached in a leadership platform. And then it is transformational. If you put the work into what the material is going to teach you. And by the way, the material I teach is not just this whole leadership stuff. It's personal development, and it's been passed down from generation to generation. My coaches, I had my own coaches. They were not medical. Bob Proctor, Mary Morrissey. They were leaders who were taught by other leaders, down to Andrew Carnegie, who was probably one of the richest guys in the world, and decided that before he dies, he needs to tell people how people get to be successful. And he was an orphan to start with, and he became this, I think he sold his steel company for $350 million, which is billions of dollars today. I really enjoy doing this. I've recruited other physicians also to help me because people who've been in through my course, especially, and people who have been ICF trained, which is International Coaching Federation. So I've been coached in multiple different places, whether it's, through Brown and from Healthcare Leadership Masters, through Bob Proctor, Mary Morrissey, but also International Coaching Federation. And I always try to improve myself so I can deliver better. Not just that in my clinical work as a endovascular specialist, but as a leadership coach.
Right.
Feedback and growth is such an integral part of being a clinician, right? Because we're always trying to get feedback and do better and do CME. But I really like the idea and the concept of saying we need to have feedback and mentoring and coaching for just being a leader.
I never thought I was going to become a leader, first of all, in the beginning. But I was put into that position. And then as I grew into that position and move up the ranks, I really enjoyed it. I started listening to audiobooks incessantly when I'm driving. I've read thousands of books on leadership, and I've spent hours, like even my vacation hours, or when I'm golfing, I'm listening to something. Like, it's ridiculous, but that's how much I've enjoyed it, and that's why I feel like I'm full of knowledge of that, and that's why I want to give back, because I can't just. I see where the problems are. I see the physician suffering, and I want to be part of the change.
Well, this has been, I feel like I've learned just in this time, Elsie, and you've given me a lot to think about, which I always appreciate. But I'm really excited that you joined us and
I should interview you guys on my podcast because
sure,
of what
we'll
you
be
guys
there.
do. So if that's
That'd
okay,
be
I might
awesome.
be reaching
Yeah,
out to you too. Yeah.
we would love
I
to.
just love the hearing
you
more
guys.
messages about success and about the hope for the future. So I'm glad someone reached out and told you how they felt, but also that you were able to like turn it into something hugely successful.
Thank you for having me. I appreciate it.
It was
Thanks,
fantastic.
me too.